I am a pre-med premature baby. I was born before 37 weeks via C-section with problems during delivery, possibly because my mom has diabetes. Within a couple minutes after birth, I began to exhibit classical symptoms of neonatal respiratory distress syndrome. These include rapid shallow breathing and a sharp pulling in of the chest below and between the ribs with each breath.
Doctor, what's wrong with my baby?
The baby seems to be having neonatal respiratory distress syndrome. I'm going to order some tests to analyze the blood gas and then an x-ray in a couple of hours. This test is verifying my suspicions that the baby has neonatal respiratory distress syndrome, as her blood shows too little oxygen and too much acid. We'll conduct an x-ray in 6 to 12 hours, which is the time it takes for characteristic morphology of the disease to form. To find out more information about your baby's condition. No, it is as I feared. Your baby does have neonatal respiratory distress syndrome. Based on the x-ray, the baby's lungs have the characteristic ground glass appearance of the disease. We will need to act soon because the lack of oxygen could affect normal development of the baby's brain and organs.
Neonatal respiratory distress syndrome affects 1 in 100 babies. It is mainly caused by a lack of surfactant, a slippery substance that coats the lungs and contributes to surface tension. Complications include bleeding into the lung, abnormal lung development, bleeding into the brain, intellectual disability, and blindness. Now we will discuss more about what happens during the disease.
I'm an alveolar, type 2 cell. I make surfactant and other things.
Yo, thanks for making me.
And I'm water. We are the walls of an alveolus.
Neonatal respiratory distress syndrome occurs in premature babies since their lungs have not had the time to fully develop. In a normal lung, surfactant, a complex mixture of both hydrophilic and hydrophobic lipids and proteins, reduces surface tension and prevents the walls of the alveoli from sticking to each other due to the water from condensed air.
But in a premature baby's lung, the type 2 alveolar cells have not had time to develop yet.
Sorry, surfactant.
Wait, does that mean I'm gone too?
Yep.
Oh,
This is cute in human terms, but very dangerous if we consider that the space in between the alveoli is where gas exchange occurs.
I understand that your child getting neonatal respiratory distress syndrome, or NRDS, must be unexpected and distressing for you. When you decide to have the baby, it probably wasn't the scenario that you imagined. The good news is that babies sometimes get better on their own. We'll also add treatments, though, to improve your baby's success chances. At this time, I'd like to discuss treatment options, if that's okay with you. There are several treatment options available. NRDS is due to a lack of surfactant in the lungs, which causes airways to collapse and parts of the baby's body to not receive enough oxygen. Treatments often try to address one of the three factors, which are lack of surfactant, airway collapse, and inadequate oxygen. One option is to provide extra surfactant. However, this needs to be injected directly into the baby's airway, so complications could arise from the procedure. Other complications that could occur down the line include bleeding into the lung.
That doesn't sound like a good option. Do you have other ways to do it?
Since your baby exhibits low blood oxygen and high acid in the blood, she could be a good candidate for using an assisted ventilator or breathing machine. However, there is the risk of damaging the lung tissue with this treatment. Another treatment that is sometimes used with ventilator or used on its own is called continuous positive airway pressure, or CPAP, whereby air is sent into the baby's nose to keep the airways open.
I know everything has risk, but I still would like to prefer a treatment that's more natural or has less side effects.
Well, I think our best option would be to use stem cells from the baby's own bone marrow. There is also the possibility of transplanting precursor cells from alveolar type 2 cells, or AV2 cells. Those are the cells that make the surfactant from an adult such as yourself, but it runs into the risk of some issues of rejection because while the baby's immune system has not developed yet, Once it does develop, the baby's cells may recognize the parent cells as foreign and attack them. There have been some studies done that indicate that transplanting bone marrow mesenchymal stem cells and their corresponding culture media from the baby can treat similar diseases in adults, such as acute respiratory distress syndrome, as well as prevent bronchopulmonary dysplasia, an additional disease that could develop from acute respiratory distress syndrome. I think this technique could apply to neonatal respiratory distress syndrome as well.
Wow. Can you explain further about the cells?
This would be done by using something like granulocyte macrophage colony stimulating factor to trick the baby's bone marrow mesenchymal stem cells or otherwise known as BMMSCs, to leave the bone marrow into the blood, from which they can be extracted. We could then inject a portion of the cells back and then culture the other portion of the cells and inject them back at higher concentrations into the baby. Once the BMMSCs are in the baby's blood, some travel through the pulmonary circulation from the heart to the lungs and will become naturally trapped in the lungs. When surrounded in the lungs by different factors, the stem cells would differentiate into AT2 cells, and the rest of the cells in the blood would just return to the bone marrow.
And the baby lived happily ever after.